Positive Solutions with Dr. Gordon is a podcast which focuses on contemporary social and educational issues from an educational leadership and behavioral research perspective. We will delve into those issues that are important to you as we listen to understand the needs of others and positively respond to address those needs, concerns, and/or fears. Professionals in their respective fields of expertise, in addition to friends of the podcast, will share their unique perspectives of positive solutions to what matters to you most. Join us every Sunday afternoon at 5 p.m. Eastern, 4 p.m. Central Time, as we share positive solutions to those issues that are important to you.
A very pleasant good afternoon to everyone, and thank you so much for joining us again for another episode of Positive Solutions with Dr. Gordon. And today we have with us again, representing from Island Therapy Solutions, Izhani Rosa. Thank you so much, and good afternoon, Izhani, for being with us again.
Hi, good afternoon.
And as you folks might know, if you watched last month's episode, Izhani is our reigning Miss St. Croix, U.S. Virgin Islands, Miss Festival Queen. And so, like I said, she wears her crown really well. However, she also not only just represents us as the Queen, she also represents us in the area of mental and social and emotional health, working at Island Therapy Solutions. And so we're very grateful that she has decided to give of her time and of her experience and expertise in areas of how we can provide continued support to individuals who are in need of that extra encouragement to help them through navigating life's journey. And so that is what this season 2 of the podcast has been focusing on, is on mindfulness and also how we can provide support for each other as we traverse life. And so, Izhani, thank you so much again for joining us. And today's topic, we're going to talk a little bit about something called compassion fatigue. And so it is a topic that some people might not be too familiar with. I've heard and received some information about compassion fatigue, but there's still so much information out there to continue to learn more about it. So ladies and gentlemen, if you have never heard of compassion fatigue, do a little Google search if you would like to, or check out various psychological journals or scientific journals and learn more about what that is about. You might find that you might even meet that criteria of someone who might be in need of a little bit of compassion and support as you provide that support for others. And basically in a rough basic definition of compassion fatigue, that's what it is. That is where someone is providing that support for someone else who might be in need. But I'm not the expert in this. I'll share the screen with Izhani and let her share her thoughts about what is compassion fatigue.
Yeah, so in its simplest terms, compassion fatigue is a state of emotional and physical exhaustion, and it usually leads to a diminished ability to empathize with others, to feel pain, or to be compassionate towards other people. And in more defined, very scientific terms, I'm just going to go ahead and read this definition off for you guys. It's a state experienced by those helping people or animals in distress. So you see that helping profession, anybody who's dealing with other people who could be in distress. This could be teachers, any kind of first responders. We have mental health professionals, law enforcement, and any kind of welfare workers. So people who are helping others, and it is an extreme state of tension and preoccupation with the suffering of those being helped, to the degree that it can create a secondary traumatic stress for the helper. All right, so here in this definition, we kind of see multiple parts. We have who's affected, which are those people who are dealing with other people who are distressed, and then that secondary kind of trauma from hearing that all the time. And you just get so exhausted from hearing all those stories and all the distress and trauma from others that you lose the ability to be even compassionate towards them.
Wow.
Yeah,
You
it's a
see,
lot.
you said a lot right there. And a number of folks who might be listening to this and viewing this might say, oh my goodness, I can identify with that. She just described me. So what are some signs that someone has compassion fatigue? Because we do have a number of individuals who are taking care of, let's say, for example, aging parents or they may have a child or children that might be ill. And when I say ill, I don't mean they have the common cold or the flu. I mean, they may have a debilitating illness that's has been going on for a long period of time, and that parent has to juggle between work, between a pandemic now, and still caring for this for the child. So are there any signs that someone has compassion fatigue that we can pay attention to? And maybe we might have a colleague that we might observe might be going through some difficult times, or as an employer or an administrator, we see
Yeah.
our employees going through some things that we can perhaps say, you know what, how may I help?
Yeah, of course. So there are actually tons of signs and symptoms of compassion fatigue, right? So the most common ones you're going to see are these like apathy. You're going to start noticing changes in your coworkers' behaviors, or maybe even in your own behavior, where you're not empathizing with the people around you anymore. You might isolate yourself. You might bottle up your emotions, and of course, a big one would be substance misuse or abuse, right? So those are like the main symptoms that kind of pop out. But then there's types of symptoms. So there's the cognitive, so how you're thinking. There are changes in emotional well-being. There's behavioral changes, spiritual changes, and there are going to be changes in your physical body and in your personal relationships. So I'm just going to list a few in each category because there are a lot of symptoms. You know, there's a lot of
They're diverse, and you're not saying that it's a cookie cutter approach that everyone must have these symptoms. It varies.
it varies from person to person, but they all kind of boil down to that lack of empathy, that the apathy that you feel towards people. So, in terms of some symptoms of compassion fatigue in the cognitive domain, so how you're thinking, you might have a lot of self doubt. You might minimize. Maybe you'll find yourself like spacing out a lot. You'll try to be perfect in every way possible. And another one, a really important one, is a preoccupation with trauma. So always thinking about the traumatic event that your patients, your loved ones, or whatever's happening in your life, always think about that event, right? So those are the cognitive things, the things that are going on in your brain that will change. And then there's emotional. So as you know, you can imagine if you start feeling all this apathy, you're gonna have like anger and rage. You're gonna feel guilty. You're gonna have survivor's guilt. So, you know, if you're in a helping profession, let's say you're a doctor, right? You're watching all these people around you kind of maybe pass away from COVID or suffering from COVID, or the family members, right? You're going to have this thing called survivor's guilt. And it is what it sounds like. You're guilty for having survived a traumatic event or an experience. So
Right.
that's a huge one. Yeah.
I mean, we've heard of, excuse me, incidences where there might have been a drowning incident where there are two people out there, one survives and the other one doesn't, and that person that survived has this overwhelming feeling of feeling badly that
Yeah.
they survived and their sibling or friend didn't. And that's just an example of survivor's guilt that you're sharing. And there are steps I'm assuming that one can take to deal with those feelings.
Mhm. Yeah, of
Right.
course. There are tons of steps that we can take, but before we kind of go into that, I really
Sure.
want to do the different symptoms because again, it looks so different in everybody. Um,
Correct.
and while you know, pretty much everyone will probably feel that apathy or that kind of like lack of emotions or like feeling what other people are feeling. There's other stuff too, you know. So
Oh,
like
share,
behaviorally,
please. Yeah.
yeah, of course. Behaviorally, you'll maybe find yourself being really impatient, irritable. You might not sleep as well. You might be like accident prone all of a sudden. Like all of a sudden, you're like bumping into everything. You're not kind of focusing on what's around
Right.
you.
Correct.
Um, and then there's a spiritual change. And I think this is really, really important because if you're experiencing compassion fatigue, you might feel like a loss of purpose, right? There might be this lack of like self satisfaction. You're going to start questioning your religious beliefs or the meaning of life. So, those kind of changes in mentality and like in your spiritual well being, your spiritual beliefs, those things happen too. You know, this is not just a only emotional or only cognitive. You'll see that kind of change too.
Right. And some people might be working really hard, and how would they be able to tell the difference between burnout and compassion fatigue?
course. So burnout is a specific type of job stress, right? It's prolonged stress in your job that causes several types of symptoms. You'll see exhaustion, cynicism, and inefficacy, right? So you're not working as well, you're really tired, and you kind of have this negative outlook on everything else around you. So job burnout really has to do with like high stress situations, but it actually is a component of compassion fatigue. There's two components. So there's that burnout, and then there's secondary traumatic stress.
Right.
So that comes from the emotional duress from hearing about the trauma or the event firsthand from other people. So those are actually two different components of compassion fatigue. And you can have burnout without compassion fatigue, but from my understanding of that topic, you can't have compassion fatigue without that burnout.
Right. As you're talking, it comes to my mind what happened immediately after Hurricane Maria. We had Irma and then we had Maria. And we had a few members of the faculty and staff that were experiencing some severe challenges. I know for one, without going into too much detail, one faculty member, her son had died, and he passed. I believe it was overseas, and of course, if you remember after Hurricane Maria, I don't know if you were here or not for that. Oh, okay, you missed it. Okay, like how I missed Hugo back in 1989. I was in college then, so I didn't experience that. But I was here for Maria. But her son passed, and she was unable to view his body because there was no electricity, and so it was not recommended that she did that. So she had to bury her son without doing that. That just impacted her, and it was taking a toll on her work. And there was another individual who went through something very challenging with a loved one of hers who former girlfriend, died violently, and also her two children. And this person who was working with us had to deal with that issue with her loved one, going through that and navigating that. And so did she. And it was, again, impacting their level and quality of work. And we had a life coach to come in to provide some support there. And it seemed to have worked, and to help them for those 6 weeks that they got that intervention to just help them along, the way. And of course, in education, we have what is called Employees Protective Agency, I'm sorry, the EAP, Employees Assistance Program, to assist faculty and staff members who might need some assistance there. So as administrators, as colleagues, as individuals working alongside another partner, we just need to be mindful of those, pay attention to those who might have those changes as you're sharing. Look out, and you don't have to get into their business, but just say, I observe, is everything okay? How may I assist you? How may I help? Might work. Yeah. Well, so I believe you touched on this. Who experiences compassion fatigue? So can anyone feel this way, or?
So it's the majority of people who experience compassion fatigue would be those who work with others, right? So it would be first responders, mental health professionals, teachers, law enforcement, welfare workers. And when I say welfare workers, I mean like anybody who might be taking care of elderly people, for instance. Right?
Correct.
So these are people that, or even animals. It could be even animals, because when you work with animals, a lot of times you're going to be exposed to maybe some like drastic things.
Right. Like, so your vet having to take care of an injured animal, but over a period of time, you're dealing with traumatized. And I've seen one of our vets here, she posts on Facebook, her taking care of abused animals, and it's just heart-rending. And so
That puts you at risk for experiencing compassion fatigue, because that constant exposure to stress and to trauma can actually get her to the point where she no longer kind of feels that empathy, or she'll start feeling apathy.
right, so she like desensitizes herself.
Yeah,
Maybe that's a form of protection, to insulate one's feelings from what's taking place. That might be a defense mechanism that's built in.
possibly.
Just a thought. Yeah.
Yeah, it's a good theory.
Right. So do you think that the pandemic has increased people's fatigue? I mean, it's a subjective question because we all respond differently to what's happening. But yeah,
I definitely think so. I think that there are so many people who, healthcare workers in general, whether it's mental health or physical health, holistic health, we're all kind of dealing with how do we cope? How do we stay healthy? How do we deal with certain things like grief, isolation? There are a lot of factors that have gone into this pandemic.
right.
We're suffering in multiple ways, and the workers who have been tasked with helping everybody who needs help, they're not getting that help themselves a lot of times, and that drives them towards that compassion fatigue you know
Right. I mean, and life happens. I've shared this a number of times on the podcast. Life happens, and we have no control over it. We had no control over the pandemic, and so we find ourselves in a position where there's like no end in sight for some people. So it's like this meandering around and around. So we find healthy ways in which we can provide that support, whether it's through a life coach, even a psychologist if necessary, or a psychiatrist if medication is involved. You mentioned the spiritual aspect, perhaps individuals returning back to their roots if they have not yet done so, if they're not grounded, or if they have taken a hiatus from their belief system, spiritually speaking, returning back to church, or having a pastor or a friend that with whom they can speak, or just having a quiet time with themselves and in meditation, having, for example, their devotions, or finding some sort of strength and encouragement through reading maybe scripture passages for some individuals, or some might read a book that has positive supportive words in there that encourages them. Those are all aspects to enhance a person's social and emotional well-being, especially at a time like the pandemic. For some people, it's not an issue. They're flourishing. There's like, hey, they're introverts, so they just need this quiet and alone time to just, wow, to create, and they're loving it. So there's that other component too. And I remember the last time we spoke, Izhani, you mentioned, hey, we get to work for those in education in our pajama bottoms.
yeah.
True. Right. And so we just find ways in which we can utilize our skills and our experiences and expertise to provide that additional support to help others, or to support others as well as what's needed.
You're listening to the podcast Positive Solutions with Dr. Gordon, which is uploaded weekly on Sunday afternoons at 5 p.m. Eastern, 4 p.m. Central, on your favorite podcast directory.
How can someone manage the fatigue if they are already experiencing it? You touched on some of the things. I don't know if you have anything else that you'd like to share as to how people can manage. We looked at we looked at the symptoms as to what people might demonstrate if they're experiencing compassion fatigue. Now, how do we manage it? And I kind of shared some, but please feel free to share some more.
So I think one that you kind of brushed on that is like so important for anything really is self-care. Like, because compassion fatigue comes from this constant exposure to trauma, right? From others' trauma. So as like a mental health care worker, let's say I get tons of crisis calls in one day, or maybe like a week. I might start feeling like apathetic towards other people. You're like, oh, like your problems aren't that serious, whatever. I need to step back and I need to care for myself so that I'm better able to care for others, right?
Right.
So self-care is huge. And that includes taking breaths, relaxation techniques like you said, mindfulness, recognizing positive things, positive situations, positive aspects in people, right? So these are all really, really important. And sometimes, taking a break from maybe the job that has you feeling this stress, that's okay. That's one of the things we talk about with job burnout is knowing your options and knowing like, hey, maybe I need to take every Monday off if you have that option, or like go on a vacation for a weekend. sometimes that needs to happen, and it's okay to do that, right?
I know in the government here we have the individuals are given 5 personal days at least, and so you have like in education you have 5 personal days that you can use. Some individuals wait until the ending of the school year because by then they're like, I'm done already, so I need a break. And the last week in April we normally have what is called Carnival over here in the U.S. Virgin Islands, but on our sister island of St. Thomas, of course, because of the pandemic, we didn't have that last year, and we're not having it this year. But that week is still a week where it's our spring break, so to speak. But I know of some individuals who are utilizing their personal days the week before, so they have that extra time just to regroup, rejuvenate, because right after that last week of April, and I'm talking to students who might be listening to this and parents who might be listening to this, guess what, folks? It's final exams. So that first week of May and also into the second week of May is final exams for our secondary schools, and then also our K through 8 and K through 6 schools and our junior high school. So just a little, I'll just slip that in there. So some teachers I know, some faculty members, and some administrators are taking some time using their personal time for the next couple of days coming up because they just need some me time to regroup so they can end strong, end the school year very strong. So I concur with you. Are there any other tips besides some me time? And
So one thing that's really important is understanding or establishing your work-life balance. So,
correct.
knowing the difference between like, okay, I'm at work, this is what I do. I have to, help these people through their trauma, through their stress. But when I'm at home, I'm at home. This is relaxation time. This is time for me. And it kind of goes back to that self-care, but sometimes it's really, really hard to separate work and home.
And so that's where I was going to say, that's where boundaries are put into place. So you need to let your boss know, your employer know, your administrator know. When I leave here, unless it's an emergency, and then define what an emergency is. If that person isn't breathing or they're bleeding out, then you call me. Other than that, I need some time for my family and I need some time for myself. So would you recommend that some people put those boundaries in place? Because some folks have a difficult time in saying no.
I know right now it's very hard for teachers. I'll always bring up my mother because she's a teacher. She's
Really?
first
Okay.
grade. Yes. And she hates when I do this, but I'm going to do it anyway. She works so hard. She goes to work and she works until like 1:30ish. I think that's when the students get out.
Right.
And
For
then
those who are face to face, yes.
she's face to face because she's a first grade teacher. And then she comes home and works until like 10 o'clock at night. She's uploading things on Schoology, and because she does have students online as well. She doesn't
Correct.
have her in-person students, and I'm just like, that's so unfair to her, because she doesn't get to separate her home and her school life. She is constantly doing work. So right now it's really important for especially teachers to understand that, like, yes, a lot of work needs to be done, but we do need to draw that line, like, hey,
Right.
this.
And I've been saying to folks, you need to pencil yourself in because you're as vital as what you are listing as the things that you need to get done. You need to take care of yourself as well. Whether it's an hour or 2 hours, to have some me time as well. And this may sound kind of harsh to some people, but it is a truth. It's a reality. I've said to some people as well, God forbid, if anything happens to you, your position is going to be filled even before you're interned in the cemetery because work has to continue.
Uh-huh. That's done.
Students have to be taught. So make sure you take care of yourself. That doesn't mean you're neglecting your responsibility, but it's about striking a balance. That's important.
Yeah. And I think that also with COVID, because teachers are getting used to now, they got used to online learning and now they have to get used to in-person and online learning. They have to be able to balance the two because it's not exactly what we were used to. So
Right.
transition, and hopefully it'll get better because I know she's not the only teacher who's going through this and experiencing this, but even the
Right.
students, they're going through that burnout as well. So
Right.
yeah.
Yeah. Sounds like mom might need a life coach to help her set some wholesome boundaries and some smart goals.
So
Just throw that out there.
another like really great strategy is journaling, just writing about your feelings towards helping or caregiving, because sometimes we might forget how much we love to help, Most people who are in helping professions or, teaching, we do that because we love it. We don't do it, just because why not? Um,
Right.
so sometimes writing about how you feel about helping and caregiving kind of reminds you that this is what you love. You're doing this because you're passionate about it and you really want to help people. So yeah, that one's a really good one that I like to do sometimes to
Like
remind.
reminding yourself of your why. Well, I know what I do, but what is the why
Mhm.
behind what I do? And once you find that why, it then brings that purpose back again, and perhaps might rejuvenate some people back onto the track as to why they're doing this and why they chose to do this in the first place, and that might help to change attitudes, mindsets, and feelings as well.
Yeah. So there's also ways that organizations can kind of prevent their employees from experiencing this compassion fatigue. And it's called organizational prevention strategies. And it's kind of
Okay.
long, I won't go too deep into it, but pretty much the organization comes together and they normalize the effects of working with trauma survivors. And they'll adopt different uh, policies that kind of promote support for staff and self care. And yeah, it's something that happens at the organizational level that, staffs, principals, your supervisors, you can kind of talk to them about that and see what kind of policies they can put in place to
Right.
support staff.
Right, and forming a relationship, an appropriate professional relationship with those with whom you work also helps. It's not about, well, you need to come to work on time. Yeah, you do. You need to have this in by deadline time. Yeah, you do. Also, in addition to that, get to know your faculty and staff or your employees. If it's, I'm
Mhm.
focusing on education, but this is beyond education.
Yeah.
To get to know those individuals with whom you work, because you have no idea what it is that they're going through, and you're adding more things on top of what they are going through without realizing what they might be struggling with, could cause something to snap. And we don't need anyone, having that
Yeah.
negative outburst at the job site, and that it can be reflected in many different ways. So we talked a little bit about like education, for example, but you've mentioned before about first responders. And so when you say first responders, what comes to my mind are like your police officers, your ambulance, your EMT, fire. Those who arrive at the scene first to take care of a crisis like an accident or
Mhm.
a traumatic incident. So are there tips for our first responders during, for example, the pandemic? So we know what it's like in education, for example, or a business, but our first responders, I mean, their whole job makeup is dealing with stressful, traumatic situations.
Yeah.
So is there anything built in, any tips that could be built in to help first responders as well? I don't want to leave anyone out.
Yeah. So, I mean, they pretty much have the same tips and tricks for
Okay.
maintaining and, kind of coping with this feeling of compassion fatigue. It's the same thing, honestly. They want to do those relaxation techniques. If they come onto a scene and there's high adrenaline usually when they're first there and they're seeing everything, but afterwards all of those emotions might hit them. Your adrenaline drops and you feel everything, right? So right then and there, they can try having those relaxation techniques. They can, meditate. They could use guided imagery, deep breathing. Those are really good for very like in the moment emotions.
Right, and I remember the last time we spoke, we did go through some of those guided imagery and the deep breathing and counting. I think it's 4, 7, 8. You know,
Mhm.
breathing in and holding your breath and then exhaling. So, um, folks, just feel free to go back and check out Izhani Rosa in our other episodes that we did prior, and you will find out more about those deep breathing techniques that could be done. That's so vital. I don't know if you remember them, if you want to share some of those now, or
So
okay.
our deep breathing exercise that we kind of share with everybody in almost every presentation because it's just so helpful and useful is the 4-7-8 ratio. So that would be you would have 4 counts to breathe in through your nose and make sure you expand your diaphragm or your stomach. You would hold for 7 seconds and then you would exhale through your mouth, making like an O with your mouth. that for 8 seconds, and then that's when you would release all the air from your diaphragm and or stomach.
Right. And we talk a lot about mindfulness and guided imagery. Any tips, like, for example, for managers or support staff, or if anyone that we know of who might be suffering from the compassion fatigue, what are some examples of guided imagery that they can consider as they do their deep breathing?
Yeah. So in terms of guided imagery, I would say going back to that kind of process that I talked about with journaling, where you would imagine yourself going through maybe helping somebody, and then getting that kind of gratitude after it, seeing their recovery, so you picture all that stuff in your head. Another great thing to do is just look up guided imagery on
There
YouTube.
you go. Right.
And they'll actually speak and you'll close your eyes. And that's what you're being guided to imagine things. And just going through that, doing positive sorts of guided imagery will help. It doesn't necessarily have to be pertaining to helping profession or what you're doing, but just getting back and focusing on the positive and remembering the positive, picturing it. That's what's really important.
Yeah, I'm not sure if it was you who said this or the life coach that I had on prior who said, imagine yourself having a task to do and accomplishing that task and being successful. And that feeling that comes along with it.
Yeah. I'm not sure if that was me. I know I've talked about guided imagery before, but in this setting or another.
Right, but these are all helpful tips to assist individuals as they navigate. And I keep using that phrase, that expression, because that's what we're doing. We're navigating life. There are things that occur that we have no control over, but then we have control over how we choose to respond. Sometimes we get into the reacting, and we don't want to react. We want to be able to respond. I mean, if you burn your hand, you want to be able to react and move your hand out of the way. So I'm not talking about that. Right, but just being mindful of situations, circumstances, and definitively making a decision of
Yeah.
selecting healthy choices to deal with that issue.
The beautiful thing about so many coping strategies, especially the ones that we talked about today,
Right,
are that they don't need to be used necessarily when you're already feeling compassion fatigue or job burnout. They can be used on a daily basis to help prevent compassion fatigue or job burnout from happening.
right. So there's prevention, there's intervention, and there's remediation. So let's start with the prevention first. Let's start incorporating those healthy practices so that whenever we are faced with those challenging moments, we naturally respond and do those things that would be helpful to us.
So we've kind of talked about, taking a step back, saying no, setting boundaries. That can be something that you practice from day one. We're at the height of the pandemic, and at this point, it's kind of, you have to be able to say no. You have to be able to step back and say, like, hey, I need to take that day off. I need to take my PL and skedaddle for a little bit. Because I'm not feeling great, mentally I'm exhausted. I'm
Right,
tired of being here, so, a lot of teachers, they'll wait and use their PL at the end, but maybe what they'll want to do is spread it out evenly. There are months where we don't have any kind of holidays, we have no kind of breaks. So maybe you want to take a 3-day weekend somewhere during that month, so
right,
that you're not constantly going, because we're humans and just can't go. We
right. I
can't
mean,
just
even our cell phones and computers, we have to shut it down so it can reboot. Our vehicles, we don't keep our vehicles running constantly. You burn the engine out or the battery out. So imagine your own bodies, and there's only one body you have. You don't go to the store and buy another body. This is it. So you got to take very good care of yourself and set those healthy boundaries that we talked about, and incorporate those healthy habits as well, and learning to say no. And also, if you have time, take time out for yourself to heal yourself, to rejuvenate, recuperate, and then come back bigger and better and stronger. And if it's even a staycation somewhere, we live here on a vacation destination, so have a day where you're a tourist. Go to those places where you normally probably won't go. We're surrounded by the Caribbean Sea. Take in the beauty. It's very therapeutic. Take photos of it, share it on Facebook, whatever it is that helps to bring you that peacefulness and that calm, and also helps others as well who might view that. Might be also, not might, but I found it to be very beneficial and helpful.
Mhm.
Yeah. Any final tips or thoughts or comments as we conclude? It's just a very short episode talking about, compassion fatigue, what it is, the signs and the symptoms we can look for, and then steps to how we can, mitigate against it, and also to provide that support for others to encourage them. So any other last minute thoughts that you'd like to share to whomever? If you even want to talk to your mom right now, who's that first grade teacher somewhere.
I kind of just want to let people know that compassion fatigue is kind of normal. Like you said, it could possibly be a defense mechanism. You're being constantly exposed to different stressors and different trauma, and a lot of times it is secondhand trauma, which happens. From hearing the same stories. Oh, I lost my grandmother. I lost my uncle. I lost my aunt. That can take a toll on you too, and that's completely valid. It's okay to feel what others are
Right,
feeling, and it's okay that sometimes you might shut down, but you do have to remember that, we can't all be apathetic humans. We need
right,
compassion in this world to keep going. So
correct,
make sure you
right.
get it. When you see it, stop, take a step back, reflect.
Breathe. 478.
Yes, breathe. I actually taught some students today about the one coping strategy that we like to use a lot, which is stop, breathe, reflect. And so I have kids from kindergarten through fourth grade, fifth grade, actually chanting, stop, breathe, reflect.
Good. No, we
So,
need that. And we'll have this here at the bottom too. I'll ask the person that's helping me with the editing to put that here. Stop, breathe, reflect, and do that as often as is necessary.
mhm.
So that's an awesome and also a very important tip for us to remember: to stop, breathe, reflect, and then find those positive things that also brings a smile to our face and makes us laugh. Because laughter is a healthy, it's medicine, and it's also healthy as well. And so there's a theme that's running here, and it's just about taking care of ourselves and taking care of each other as we navigate something wonderful called life. And if it's not challenging you, it's not going to change you. However, we need to just maintain that proper balance as well as we grow and become a better version of who we are. And I think this is a nice segue to conclude where I normally would say, we have faith, hope, and love. Compassion is included in that love, ladies and gentlemen. So as individuals, let's make sure we maintain that compassion, that love, which helps us to become even better and to become even stronger together. So I'll see you next week.
Thank you for having me.
Thank you for joining Positive Solutions with Dr. Gordon as we learned about different perspectives of contemporary social and educational issues. We hope to educate and encourage as we analyze those topics that are important to you. Please continue to join us every Sunday afternoon at 5 p.m. Eastern, 4 p.m. Central, as new episodes are uploaded on your favorite podcast directory. Remember, become that positive difference that creates a positive outcome in the lives of others, as well as in your own life. See you next Sunday afternoon on Positive Solutions with Dr. Gordon.